Hey, hello, Facebook friends. Testicular Cancer Awareness Foundation, BJ Lang here, and this is another Testicular Cancer Awareness Month Ask the Doctors segment. If you're just now joining us, or if you're watching this on repeat, you could still ask your questions in the chat. We will try to do our best to get back to you. We are preparing for our virtual testicular cancer conference, which is coming up on the 20th and the 21st of April. Today, we've got a special guest who will be joining us. So I hope you'll stick around and ask that. And feel free to tag and like and share and comment and add your friends to this. Especially if you're watching us right now on Facebook in the moment, if it's live, I'd really encourage you to ask some questions, because that's why we ask our guests to be with us today. So before we get to our guest, let me just walk through some things here. Again, I'm BJ Lang. I'm a board member for the Testicular Cancer Awareness Foundation. I'm a two-time TC survivor. And I, again, encourage you to ask questions throughout today's conversation. We're probably going to be here for maybe 15, 20 minutes or so, and just kind of, enjoy ourselves and talk with fellow survivors. Maybe if you're a caregiver out there, even if you're a researcher, our guest today loves to talk to researchers. So good opportunity for you to get some questions in here and celebrate Testicular Cancer Awareness Month. All right. We'll have a few more of these live discussions throughout the month of April. I know we have one tomorrow and one on Friday, so I hope that you'll come back and join us for those as well. And I want to make sure that you had the opportunity to listen to the Testicular Cancer Awareness Foundation's official podcast, It Takes Balls, because it does. And that's hosted by TC survivor and fellow board member, Stephen Crocker. So check out our TCAF podcast when you have some time. Mark your calendars again, the 20th and the 21st from 8 to 9 p.m. Eastern time. That's 5 to 6 Pacific for the virtual Testicular Cancer Conference. That's 2 evenings full of wonderful discussions, wonderful guests that are going to be joining us. They're going to be covering some very important topics, some things that maybe you might be interested in hearing. Why did I get testis cancer? COVID and the vaccine, and how it relates to testis cancer. There's going to be great long discussions on the side effects and prevention of testis cancer. We're going to have breakout rooms with the doctors, and you'll be able to connect with Stephen Crocker, as I mentioned earlier, from It Takes Balls, the host of the official TCAF podcast. And we'll have updates from our friends at the Uniball movie. They're going to be here with us as well. If you haven't been following that, it's going to be pretty awesome. We'll also have Q&A with some testicular cancer medical experts, and we'll have doctors from Penn Presbyterian Hospital, Penn Medicine, Indiana University School of Medicine that work closely with Dr. Einhorn, today's special guest, perhaps. Folks from the University of Colorado Hospital and Children's Hospital Colorado, as well as UC San Diego. If you got to watch our guest the other day here on our Facebook Live Ask the Doctor segment, you got to meet him. You'll be able to meet with other survivors and caregivers from across the United States, as well as other countries. We have folks that join us from all over the globe, so you'll be able to make some great social connections. If you haven't been able to attend a TCAF in-person conference, well, this virtual option is perfect for you. So join us. I hope that you do that. All right, it's time to have some fun today. And again, if you're just now joining us on Facebook Live, pop your questions in the chat. We've got a doctor, and we're holding him close here. So get your questions ready. As I mentioned, we have some of the best experts in the TC community coming to the virtual Testicular Cancer Conference, and today's guest is no exception. He will be at the TCAF Virtual Testicular Cancer Conference, which again takes place the 20th and the 21st of April. He'll be speaking on the long-term side effects and how to prevent them with TC. He'll also be available to speak with you during the Ask the Doctors segments and to answer any questions that you might have in regards to TC. For instance, treatment, side effects, long-term care, and more. Those sessions are going to be very small and intimate at the virtual conference, so you'll definitely be able to ask your question. Right now, if you do have questions, again, put those in the chat. I want to make sure that you get your question in there before it's too late. And again, even if you watch this after we go live and it publishes on our Facebook and across other social media platforms, you can still put your questions in there. And I highly encourage you to join our peer-to-peer Facebook group so that you can get questions one-on-one with people as well. Our guest today has been practicing medicine since 2010. His commitment to his patients and their overall well-being is to provide them the best care possible while establishing long-lasting relationships. Today's guest is a His clinical interests include medical oncology with a specific focus on urologic oncology and the treatment of prostate, testicular, bladder, and kidney cancers. He's a hematology oncologist at the University at Indiana University Health. Please welcome Dr. Nabil Adra. Hey, Dr. Adra, how are you, sir?
Hey, BJ, how are you?
Great to be with you today. Great to be with you. So first of all, how is life in the Midwest? I'm from St. Louis, so I get a little homesick.
Life is great, especially this time of year. Weather's getting a bit warmer, so everything's looking much better right now. Yeah, we're all happy.
I believe that. So you've been in Indiana now for what, 10 years?
Yeah, 10, 11 years. I came here around 2011. I did my internal medicine training here at IU. During that time, I sort of met the great testicular cancer doctors here, including Dr. Einhorn, et cetera. And we did some research work. And so I ended up staying here for my subspecialty training in oncology and specifically focusing on GU cancers, mainly testicular and prostate cancer. And I've been on faculty here for about 5 years now. So
awesome. What drew you into urology specifically? And you were like, I want to go into oncology. Do you have a history with that, or?
The main reason I went into oncology in general is I just wanted to go into a field where I feel like there's room for improvement and we can actually make a meaningful impact. Medicine as a whole is a great field, but oncology in particular, I feel like, is a very rewarding field where you can have substantial impact. There's lots of room for improvement. There's lots of room to improve on our current treatments, on the long-standing effects that we see patients suffer from over time. And sort of our goal and mission is to try to improve those treatments for those patients suffering from cancer.
Absolutely. Now you're going to be speaking a little bit about that at the upcoming virtual testicular cancer conference. Can you just share with the folks what you'll be presenting at the virtual conference and maybe why they should come?
Yeah, so, one of the things that we always think about testicular cancer is it's a very treatable, very curable cancer, which is all great. We're all very happy. About 95% of patients who are diagnosed with testicular cancer will end up being cured of their cancer. But what is a bit under-recognized is as those patients who are survivors of testicular cancer will still have long-lasting effects of their treatment. Those treatments, which can include surgery, radiation, or even chemotherapy, sometimes 2 or 3 rounds of chemotherapy, and sometimes even intensive doses of chemotherapy and stem cell transplant. Those treatments can have long-standing side effects that can impact the remainder of those patients' lives or those survivors' lives. And those long-standing effects are under-recognized, I feel like, so we're trying to raise more awareness to those long-standing effects and sort of try to figure out ways how to best identify them early and potentially even prevent them in the future. That
makes sense. Dr. Adra, what would you think are the most important things for a testicular cancer fighter, a patient who's newly diagnosed? What's like the number one thing that you always make sure that you tell them?
The most important thing for patients who are diagnosed with testicular cancer is to know this is a relatively rare cancer. It's not a very common cancer. And there are experts who treat this cancer solely across the world, and that's their area of focus, where they focus on testicular cancer only. And so I always encourage my patients to get expert opinions or seek opinions from physicians or doctors who treat this cancer for a living and who specialize in this particular type of cancer. This is extremely important because this is, as we mentioned, a potentially curable cancer in the vast majority of patients. But it's only curable if you get the appropriate treatment. Moreover, what's also important is those patients hopefully will be cured and hopefully they will live 10, 20, 40, 60, 80 more years of life. Because as you know, testicular cancer patients are typically patients diagnosed in their 20s and 30s. And so what we try to avoid as well is to try to avoid over-treatment, meaning getting more treatment, more surgery, more radiation, or more chemotherapy than what a patient actually needs. Because if a patient gets more treatment than what is necessary, then that patient is going to live with the long-term side effects of that additional therapy that they might have not required. So those are things that I think are very important to highlight, and I always let my patients know is always seek expert opinions. Testicular cancer as a field is a bit special and unique in a way that I feel like all the experts at testicular cancer are willing to help out. We get emails, we get phone calls from across the country and honestly from across the world about patients who are seeking opinions, and we're always happy to help, always happy to offer our opinions so that patients get the best care possible.
Awesome. I love that commitment right there. Welcome, everybody. If you're just now joining us, this is our preparation for the upcoming virtual testicular cancer conference. We're here with Nabil Adra. He's a hematology oncologist at Indiana University Health. And this is a great opportunity, since it is Testicular Cancer Awareness Month, to put a question in the chat. If you're joining us now on Facebook, go ahead and pop those in the chat. Our team here at TCAF working in the background, sharing this across the social media platforms, bringing those questions over to Zoom so that I can ask Dr. Adra. I'm going to ask you this, Doc, what's it like working with Dr. Einhorn? I mean, the guy's a legend in the field. So what's that like?
Everybody's interested in that. I say that, Dr. Einhorn is the first guy to walk into this building in the morning, and he's the last guy to leave this building in the afternoon. So he sets a pretty high standard for all of us. But in all truth and all reality, he is extremely, of course, knowledgeable, but not just knowledgeable, extremely kind and good person. And his main legacy in my mind is going to be not only the treatments that he's developed to cure testicular cancer, but even more importantly, the generations and generations of oncologists that he's trained over time, and not just trained with medical knowledge, but in my opinion, also trained as far as how to treat patients, how to respect patients, and how to offer your support for patients who require help so that they can get the best treatment possible for their cancer. So
awesome. That there's a little part of me that just like got a little bit more happy to hear that. That goes a long way. Hey, do you get the opportunity? I'm going to talk about you for a minute and kind of get to know who Nabil is here personally. So I know you're from Lebanon. Do you get the opportunity to go back home, and do you have colleagues that work there, and do you bring your experience in the field back home?
Yeah, of course. So yeah, I'm originally from Beirut, Lebanon. I went to medical school back there at the American University of Beirut. And then, as mentioned, I came here for training. So I still have family and friends back home. I still go back home, visit frequently, and connect with colleagues back at the American University of Beirut. I was actually giving a talk about testicular cancer to our colleagues back in Lebanon a few weeks ago. And we always try to sort of foster collaborations so that the care for patients with testicular cancer out there in the Middle East is improved as well. So that's one area that's actually my own interest as well, is to improve the care for testicular cancer patients in that area of the world, which is underserved. So.
Awesome. What would you say to maybe other researchers, other practitioners, other providers from around the world? Maybe, hey, this is a challenge to come to the virtual testicular cancer conference. Yeah. We're open to everybody. My point is not just for survivors, but to a caregiver as well, to researchers, other providers from around the globe, to come and see what's happening. We want to be the focal point of what's happening here in testicular cancer specifically. So yeah, very, very good. Dr. Adra, what are some questions that you think are the most important that a newly diagnosed patient should ask their urologist and or oncologist?
Yeah, so some important questions are essentially, of course, what type of cancer am I dealing with? What subtype of testicular cancer am I dealing with? Testicular cancer is a big word, right? But there are certain subtypes. There's seminoma, non-seminoma, and other types of testicular cancer as well. What stage of cancer am I dealing with? What sort of treatments would I need? Am I going to need surgery alone? Am I going to need surgery and chemotherapy? Those sorts of questions. And then importantly too is, what are some of the long-term side effects that I'll be facing based on those therapies that I'm going to get? And then eventually, what are my chances of being cured with this sort of approach with treatment? And if I'm not cured, if I'm among that small percentage of patients who are not cured with initial treatments, what are my options at that time?
Sure.
Those are questions we all think about. Testicular cancer is always thought of as a cancer that's largely curable, which is great, but there is a small subset of patients who are not cured with our usual treatments. And that's a personal sort of area that I focus on as well, is developing new treatment options and novel therapeutics for patients who have refractory testicular cancer that is not cured with our current treatment options.
Awesome. Thanks again for joining us. If you're just now watching the Facebook Live, or if you're watching this on repeat, you can still put your questions there in the chat. You're joining us with Nabil Adra. He's a hematology oncologist at Indiana University Health. And this is of course, Testicular Cancer Awareness Month. So we wanted to get you the opportunity to ask a question to the doctor. We have a few questions that are in the chat. And as we compile even a few more questions here from the chat, a question for you that this is a personal question. I'm approaching now my 5-year mark from my remission. When is the appropriate time to start the clock for that 5-year stamp to where I can say that I'm cancer-free? Do I use my clean CT scan, or when I started my treatment? Like, what's the day that I start that off?
Yeah, so typically we would follow patients, and it depends on what sort of treatment they got, but if they had surgery only, then the clock starts from the time that they had their initial surgery. If they had surgery and chemotherapy, then the clock would start from the time that they had started their chemotherapy treatments. And then we start counting from there on. But that's a very important point as well, because we see lots of patients who are followed for 5 years, and then they're deemed, or their doctors tell them, all right, you're good, you're cured of testicular cancer, you're done, go follow with your primary care doctor. And we strongly believe that this is wrong. And this is sort of something that Dr. Einhorn has instilled in us as well, because there is about a very small chance, about a 1 to 2% risk that the testicular cancer would recur after 2 or even after 5 years of treatment. And that's why we prefer to follow all patients with testicular cancer indefinitely, at least once a year, with a physical exam and blood tests, because for the most part, those late recurrences, we are able to diagnose based on just a blood test.
Good to hear that. And I'll have to have a discussion with my oncologist. There we go. All right, Dr. Adra. So some questions coming in here from the Facebook. And again, if you have a question, go ahead and pop it in the chat. We have about another 10 minutes or so before we wrap this up. Okay, a question from Rob Blake over on Facebook. Do you envision a time when guys could be assessed for testicular cancer before it happens, like we have for the BRCA1 and 2 or the PSA, though we know that not to be perfect?
Yeah, that's a great question. So I guess what this person is alluding to is, can we screen for testicular cancer, right? Is there a time where we can catch it early before it actually is large enough or before it spreads anywhere? So right now, we don't have a good screening technique for testicular cancer. So essentially, patients, unfortunately, we wait until the patient develops a mass or they feel a lump in their testis or they have other symptoms. There are newer tests that we're looking at to look for screening for testicular cancer. None of them are ready for prime time, but in the testicular cancer world, you probably know that there are very good blood tests called tumor markers. AFP and ATG are the very best in those for testicular cancer. Well, there are newer blood tests that seem very, very promising in detecting very small amounts of cancer. The most promising of those is a blood test called microRNA 371, which is a non-coding microRNA. It's just a blood test, sort of a protein detected in the blood. This can detect very, very small levels of testicular cancer cells. So yeah, you might envision a time where you do a blood test, just like you do a PSA for prostate cancer, that you might do a blood test for young men, maybe in their 20s and 30s, once a year or so. And if you see an abnormal blood test, then you might consider that this patient is higher risk of developing testicular cancer. But this is not ready for prime time yet.
Interesting. Well, I mean, and see, this is another reason why, you know, the researchers out there and the folks who are on the leading edge of what's happening, or maybe you are a urologist and you're not seeing a lot of TC patients, or you're out of practice or whatever, get in here to the conference. Come join us here on the 20th and 21st and come see what's going on. All right, another question from Ingrid C. Ingrid says, thanks for all you do. Are there any chances, what are the chances of recurrence elsewhere after 2 orchiectomies? It looks like 1A, seminoma, both bilaterally, I'm assuming. No other involvement or spreading. Thanks.
How many years out do we know? Or they didn't say, huh?
They didn't say.
Yeah, so if it's newly diagnosed bilateral seminoma, so this is stage 1 bilateral seminoma, if it's newly diagnosed, the chance of relapse is not super high. Usually it's somewhere around 10–15%. So those patients should be followed closely with surveillance. If this patient is more than 2, or even if they're 5+ years out, then the chance of relapse is very, very low. We're talking less than 1%. So
copy that. Thanks again, Rob Blake, for your question. Another question: what lifestyle factors, if any, can be done to prevent testicular cancer? Oof, I know we talk a lot about this at the conference. People always want to know, how did I get it? Why did I get it? Yeah.
That's a tough one. I don't know if there's a lifestyle change that you can do to prevent testicular cancer to happen, we know that the biggest risk factors for testicular cancer are if you have an undescended testicle when you're young. So that's something to always look for. So somebody who was born with an undescended testicle, even if they did a surgery to bring the testis down to the scrotum early, that patient is at high risk of developing cancer in that particular testicle and should be followed very, very closely and should do self-exams, etc. We don't have any data of anything or any lifestyle changes that you can do to prevent yourself from getting testicular cancer. Although, if you did have a diagnosis of testicular cancer, there are things you can do to prevent long-term adverse health outcomes and long-term side effects of the treatment of testicular cancer. And those are stuff we'll talk about at the conference.
See? Another reason why you need to come to the conference. We're not trying to get Dr. Adra to give away the whole farm here. So join us for the conference. It's so easy for you to join us. Check out testiscancer.org if you would like to register for the conference. And I'll talk to you a little bit more about that. Dr. Adra, I'd like to know more about the new potential test for active cancer in lymph nodes after chemo. Is that close? Is any more known about and then the follow-up to that, is there anything else known about the causes of TC, which I know you just hit on, but going back to that first part, the new potential test for active cancer in lymph nodes after chemo?
Yeah, so I think they're alluding to that microRNA test again. So that it is a very promising test. You know, we have to sort of, everybody's very excited about this test, and hopefully this will change the standard of care in the future. But it is still early days. There are large clinical trials that are investigating this microRNA test. I personally, and here at IU, we have many patients who are enrolled on those clinical trials that is going to look at the validity of those microRNA tests in predicting whether patients have residual testicular cancer or not. Again, the idea is we want to limit the morbidity of our treatment. So if we can get by with less treatment, then that would be great. So, and that's the idea behind this blood test, is if we can avoid post-chemotherapy surgeries, or if we can avoid additional chemotherapy, that's the ideal goal of this new blood test.
Makes sense. Denise asks, what clinical trials are you currently involved in regarding testicular cancer? And I guess the follow-up to that is, are you aware of any other ones?
Yeah, so here at IU and me personally, we're involved in a number of clinical trials. So the first is a trial that's looking at patients who have relapsed testicular cancer, meaning testicular cancer that was treated with initial chemotherapy and unfortunately progressed after initial chemotherapy. And those patients, at least here at our institution, we favor intensive treatment with high-dose chemotherapy and stem cell transplant to achieve the best chance of cure. But even with high-dose chemotherapy and stem cell transplant, we only cure about 60% of patients with such disease. And so we do have a clinical trial that's looking at giving maintenance chemotherapy as a pill, etoposide pill, and not as an IV treatment, but as a pill for 3 months, in order to improve the outcomes and improve the cure rates in those patients with relapsed testicular cancer. So that's one trial we're looking at. Another trial we're actually pretty excited about is a trial looking at a new targeted therapy called cabozantinib. This is a drug that targets multiple pathways that are overactive in the testicular cancer biology. And we do have a phase 2 trial looking at this drug in patients who have refractory testicular cancer, meaning cancer that has progressed after first-line therapy and unfortunately was not cured after second-line treatment with either regular chemo or high-dose chemotherapy. And this drug seems pretty promising. We are very excited. We don't have any official results yet. We will present those results at a later time, but we are quite excited about this clinical trial. It's important to say that we've done a number of clinical trials, 4 or 5 trials looking at targeted therapy in testicular cancer. Unfortunately, none of them have been very successful. But with this particular trial, we are actually quite optimistic. That's, I think, the extent that I could say right now. And then lastly, we have a number of clinical trials looking at this new biomarker, the microRNA 371, to detect minimal amounts of testicular cancer cells in the blood. So
very awesome to hear about these clinical trials and just see what's going out there, you know, right now, because this is, you know, the future. It's where we're heading. It's really neat. A few more minutes here with Dr. Adra, hematology oncologist, University of Indiana Health. If you are Indiana University Health, if you're interested in posting a question here, we're on the Facebook Live. It is Testicular Cancer Awareness Month. We're preparing for the April 20th and 21st upcoming virtual testicular cancer conference. Pop your question in the chat. I don't want to take up too much more of his time. A question for you, Doc. Do you feel like, let's see here, microlithiasis is an indicator for testicular cancer?
Yeah, so we don't have good data as far as whether microlithiasis increases the risk. We know that sometimes it gets a bit challenging when you see microlithiasis on ultrasound, whether you're dealing with a benign finding or whether you're dealing with something more ominous like testicular cancer. So it is something that we follow more closely, but there's no direct relationship at this time.
Copy that. Dr. Adra, I know it's probably early, they say here on the Facebook chat, and probably not enough information, but do you have any thoughts on the CAR-T and CAR-VC for TC relapse?
Yeah, that's a great question. So we don't have any initial data yet in that aspect. There are some institutions looking at CAR-T in testicular cancer and other cancers as well. So there is no published data there. I'm not aware of any data right now as far as the effectiveness of those treatments in patients with relapsed testicular cancer.
All right. Hey, thanks so much for all your questions, everybody. Really appreciate that. Thank you to Denise and Rob for your questions. Hello to Paul, fellow survivor, who is out there watching as well. And Dr. Adra, I can hear that you are a busy man. I hear the emails coming in. We got to let you get back to work. I can't keep you here that much longer. I can't keep you here that much longer. Anything you want to say to the folks out there that are watching, fellow TC survivors, caregivers, anything to your colleagues, their fellow survivors, anybody?
No, all I say is I look forward to seeing you next week at the conference. I hope it'll be a big turnout, and it's always fun. It's always exciting to meet up with colleagues and also to meet up with patients and survivors and discuss how we can improve the outcomes of this disease. So look forward to it.
Awesome. Enjoy the lovely weather there this summer in the Midwest, Dr. Adra. I'm a little jealous, a Midwest boy. So I'm a little jealous that you're there. Maybe if I go visit my parents back in Missouri, I'll have to pop over there and see you over in Indiana.
We'll have you out for a drink for sure. All right.
Sounds good. Thanks, Dr. Adra. Again, we appreciate you, Dr. Adra, for joining us, and for all of you watching here. We've got to. I'm going to wrap us up here. But again, Dr. Adra, thanks again for hanging out with us.
All right. Thanks, BJ.
You bet. All right. Well, that's it from this today's, at least, Ask the Doctor segment. We got a few more of these that are going to be coming up here in response as we prepare for our upcoming virtual testicular cancer conference. If you are unable to pay for the registration, if you want to come to the conference, and we're asking for $9.99 per household to come to the conference, if you're unable to get that, no worries. Let us know here at TCAF. We want to make sure that you and your family can come. And I do mention family. If you got a loved one here that's a caregiver, if you are the caregiver and you want them to come, we want your whole family to be able to come to the conference, ask questions, see what's going on, connect with other survivors. We will help you with that. And let me be clear that money that we're asking for doesn't come to TCAF. We are donating that money to the John Cleland Fellowship at Indiana University. You can check out John's story and his legacy about testicular cancer on our website. So that's going over there to help them and to his fellowship. If you're not familiar with that fellowship, it's very heartfelt and very important what they're doing over there. One of the first TC folks in modern, what we would consider modern treatment for testicular cancer. So check out the John Cleland Fellowship. You could register now at testiscancer.org. And thanks again for joining us. Be sure to tag your friends, fellow survivors, caregivers, and invite your research colleagues and your medical colleagues to join us here for the upcoming conference. Let us know what you thought of today's Ask the Doctor segments. If you have questions for the doctors for the upcoming conference, if you want to post a question here in this chat, or if you'd like us to cover something specific at the conference that we're not already doing, let us know. That's what we're here for. That's what we're all about here at TCAF, to help everybody out. Join us tomorrow. We'll be with Dr. Clint Carey, and then Friday we'll be with Dr. Nick Cost here on Facebook Live, as well as our other social media outlets. And we'll see you the 20th and the 21st at the upcoming virtual testicular cancer conference. From all of us here at TCAF, so long. Bye-bye, everybody. All right.